Professor of economics at UCLA. Her research focuses on the well-being of the elderly, which will be a big part of our discussion here this afternoon. She served as faculty research fellow at the National Bureau of Economic Research and as a senior economist on the White House Council of Economic Advisors.
So if you look right here, this is about where we are now, and this is forecasted to be going out into the future. And you can see an enormous fraction of our population is going to be in this 65 and over age group in the not too distant future. And as a society, we have to figure out how we're going to provide for these individuals, take care of them with a very small fraction of people who are actually still working. So this goes back to what Valeria talked about yesterday. This is the poverty rate for the first year in which we have a measurement, 1959. And if you look at the poverty rate for the country as a whole, it was 19%. You see it for what economists call the working age population, for children, where it's very high, and then for the elderly. So for the elderly, it was extremely high, and there's sort of no debate about whether or not these people should be working. Are they shirking by being unemployed or anything? We don't expect older folks to be working, and they had these very high poverty rates. Then came, if you break this down by different demographic groups, and you look at what we talked about before, these are typically widows, elderly women living alone. It was almost 2/3 of them who are in poverty. So this is enormous, and this is despite the fact that many of these single women live with children. Those would not have been counted as poor because they were living in a family with income above the poverty line. But these are the ones who didn't even have family to rely on. They had a hugely high poverty rate. Then came the war on poverty, and the most recent poverty rates we have now are 2013. And you see poverty rate fell across the board here, about 20-25% across groups. But when you look at what happened to the elderly, there was this enormous decline in poverty, about 75%. So we did really well in this war on poverty in terms of the well-being of the elderly. And if you look at one of the reasons behind it, or the big reason behind it, this red line is a decline in poverty for the elderly. The blue line is average Social Security benefits. So in an 8-year period from 1965 or 1966 forward, we had an 85% increase in Social Security benefits. So you can see that big spike in average Social Security benefits. At the same time, there was a decline in poverty. So a big explanation for this increase in the well-being of the elderly was the Social Security program. Right? It was government intervention, a public transfer program that really benefited the elderly. And that's why we don't see those big changes or gains in poverty for the other groups. We didn't have any really enormous social welfare program that would help them. And just to see why Social Security is so important, this is the, in 2008, the bottom quartile, so the bottom 25% of the income distribution, and this big red component is Social Security. So for the low-income population, those who are at risk of being poor, remember the poverty rate for the elderly is about 9%. This is the bottom 25%. Social Security is about it. The next largest category is this blue one. That's SSI. That's a government transfer program, a means-tested welfare program for the elderly, blind, and disabled. So that's where their income is coming from, government transfer programs. For the highest income quartile, Social Security is a relatively small part. They have earnings, they have asset income, and pension income, which doesn't really exist for the low-income population. So by changing Social Security, increasing Social Security, we had an enormous effect on the well-being of the elderly, of the poor elderly. And in measures other than income, these are assets. So this is the change in assets over time for the elderly from 84 to 2009. You see things got better. If you look at the younger population, under 35, things got worse. So not only are the elderly better off in terms of just an income measure that we use to define poverty, they're better off, much better off in terms of assets. And this is home ownership by age, so the elderly are also much better off in home ownership. So they've done really well as a group for the last few years. But we also have these enormous pockets of poverty. And when we look at average and population averages, we have to realize there's differences underneath it. So here's the poverty rate for the elderly. They're doing really well. It's below that for children and the working age population. But as soon as you start looking at these subgroups, you see some people who have enormous risks of doing poorly. So you look at the population for those elderly women living alone, that's 19%. But look at black women or Hispanic women. For Hispanic women, almost 60% of elderly women are in poverty. So that's an incredibly high number. So we can't just look at the elderly and say, we've done really well, we don't have to worry about them, because we do have some groups who have really been left behind. So in terms of the policy implications of what happened, we've had this huge increase in Social Security. And one of the things that happened because of that, and sorry, I don't have it, is elderly women. I thought Joe had this slide, so I didn't put it in. But there was enormous change in the fraction of elderly women living alone. It used to be most elderly women lived with their children. Because of this rise in Social Security, they were able to live by themselves. One of the other things that happened over this period of time was we replaced these state-run welfare programs called Old Age Assistance Programs, or OAA. Those were replaced with the Supplemental Security Income Program that started in 1974 under Richard Nixon. One of those things the Old Age Assistance Programs did was they had relative responsibility clauses. Children were legally obligated to take care of their parents. You could not collect welfare from the state unless you could prove your children couldn't care for you. And the state would sue your children for financial support if you didn't want to. So when we changed the state programs to a federal SSI program, we got rid of that. So we sort of, as a society, decided to change this definition of who is responsible for whom. Joe pointed to the catechism, but even as state governments, we were requiring children to care for their parents. And then we changed the law on that. We sort of went the other way when we replaced AFDC with TANF, and we now require minor children of children of their own to live with a parent or guardian in order to collect welfare. So when we write laws and provide public support, we actually often define the responsibility of the family. So because of these changes over time in the well-being of the elderly, what we see is that cash transfers tend to flow what we call downstream. Most of the money tends to flow from parents to children rather than from children to parents, as used to be more so in the past. So in the data I had that differs a bit from Joe's, about 30% of older parents gave something to their children in any given year, and about 9% of children made a cash transfer to their parents. He was showing both cash and time transfers. This is just financial transfers. Okay, so I'll talk a bit about transfers to adult children, since that's more of what we see. And one of the things that I want to show here is this takes a group of adult children who are on average 31 years old in 1992, follows them through to 2008. So they go from 31 to age 47. And this is the probability they received a transfer of $500 or more from their parents in that particular year. And despite the fact that these children are really, they're growing up, right? They're 48 years old, they've bought their house, they've paid off their student loans, they have their job, and there's very little decrease in the fraction who are getting financial transfers from their parents. So these parents continue to give. They're well out into their 70s at this point, and they're still making large cash transfers to their children. And this is the average amount of transfers, conditional on a positive one. So these are older children, they're 48 years old, they're still getting a lot of money from their parents. So this parents helping their children start out, we think of it, Joe showed the money to buy a house, to buy a new car, pay off student loans. It continues long after those sort of setting up issues are resolved. Okay. So another thing to look at with those data is how much variation there is over time. Now, when I first looked at this, I was thinking, okay, there's this lucky group of 14% or so of children who every year at Christmas, their parents give them this $10,000 check. Year in and year out, they're doing really well. But it turns out that what you actually have is very few people are like that. If you look at this whole group, all those children who received at any point over that 17-year period, most of them got only once. Almost none, less than 1%, received it every single year. So it's not that case where it's this rich kid who gets it year in and year out. Parents are giving in some years and not in others. And most of the time, it's just 1 or 2 years. That takes care of just about everybody. So if you think of what parents are giving for, you can think of sort of these happy events. They graduated from college, right? They got 16 years of schooling. So about 20% of them received a transfer, and there's the amount, much bigger than those who did not graduate from college. They could get married. You see those who got married had a higher probability of a cash transfer, those who bought a home, those who had a child. And this is the largest amount in the table. If you had a child, you got a big gift from your parents. But then there are also sort of negative events. Children who lost a job are much more likely to get a transfer. That's bigger than any of these sort of positive things. And the highest probability of getting assistance from your parent is if you get divorced. So this is when parents are stepping in to help out their children. They had this negative shock, they split up, they might need help getting a new home, an apartment, something like that. But you see much more likely to get a transfer. And I thought when I first looked at this, like, is there going to be a difference with sons and daughters? Are they helping out their daughters who get divorced and not their sons? And there is no difference. They're equally likely whether it's a son or daughter who's getting divorced. Okay, so I show this to my students. Nobody knows who these people are up here. So how do parents divide things among their siblings? So what I did here is divide families by the number of children, 2 children, 3 children, 4, 5 or more, and then look at the fraction of those families who made a transfer to at least 1 child. So in all those families with 2 children, 75% of the time, parents made at least 1 transfer. Then I looked at how likely they are to make equal transfers to all their children. So if you have 3 children in your family, 78% of the time, the parents made a transfer to at least 1, but only 4% of the time did they make equal amounts to all 3 children. Well, that might not be surprising. Equal is a strict definition. So if we do within 10% of each other, see it's a tiny bit higher, but doesn't really change. 20%, it gets a little higher, but still doesn't change. Parents are transferring different amounts to their children. Well, that makes sense with that previous slide that showed you they're giving for graduation, a new home, a divorce, a new child, specific events. So you can think, well, if we look over the lifetime of a child, maybe these things become more equal. Right? These events happen in different years to different kids. If we add them all up, they should be much more similar. But it actually happens if you aggregate over that whole period of time, they become more unequal. So it's not the fact that things balance out, it's that the same children continue to get. There's one child who's not doing well, and the parent continues to help that child, not his siblings. So you see, within 20%, give within 20% over this 17-year period, it's only 2%. Then if we look at where the transfers are going, so Joe talked about the expense of schooling. So about 40% of parents in the sample made a transfer for schooling. These are for children who are all done with school, so they're older enough and not going back to school. The average amount was $8,500. Conditional on making a transfer, the average amount was $21,000. So they're giving a large amount. If you look at cash transfers in a particular year, not for schooling, so these are for kids who are out of school, only 17% got a transfer in that year. The average amount was $1,500. The conditional mean was $9,200. But then you start adding up these non-schooling cash transfers over time, from 2000 to 2008, then from 1992 to 2008. And what you see, surprisingly, is these cash transfers, long after the children have left school, end up being larger than those schooling transfers. So even though we know schooling's a burden and we hear parents talk about it all the time, they sort of willingly transfer even more to their children going forward. And then if you add everything together, what you see is parents do invest a whole lot in giving to their children over time. Okay, so Joe promised I talk about bequests, so this is King Lear. So anytime people talk about bequests, they quote King Lear. So I showed you how unequal those cash transfers are, those inter vivos transfers while the parents are alive. The other side of the coin are bequests. And economists look at these as substitutes. What you don't give to your children while you're alive, you can leave to them in your will. And conversely, any assets set aside in a trust or something in your will, you cannot give them while you're alive. So we'd expect to see very similar distributions. You're helping the kid who's not doing so well, so forth. But you don't. Just about all the time, wills divide the estates equally among their children. 90% of the time if we look at probate, 88% of the time if we look at state tax returns. If we ask people about wills in different surveys, 83, 92% of the time. And if you remember those inter vivos transfers, those were less than 10% of the time. Are they equal? So what's the difference? What is going on? So one of the aspects that's gotten a lot of attention is bequests are public. Okay? Your estate's going to go through probate. Your children are going to know that you gave more to their sibling. And maybe you can hide those annual cash transfers. Maybe they don't know about it, and you don't want to sort of the last signal you send your children is you gave more to a sibling and another. That's the story that's gotten the most attention, The problem with that is, if we could talk to the lawyer here, it's very easy to set up a trust that would not go through probate. Nobody would ever know what goes through there. But it's still possible. The other thing is the future is uncertain. If you want to help your children out when they get divorced, laid off, have a baby, something like that, you don't know what's going to happen after you die. Your children are going to live another 40 years or so forth. So you don't know what's going to happen. On average, these shocks might be equal, so you give equal. And finally, something that I think does have a lot of credibility is this idea of social norms. I was giving a paper on bequests and taking the subway back to the airport in the city, and there was a woman who asked me what I was doing in town, and I explained I was talking about bequests. She said, oh, I just met with my attorney to write a will. She said, my daughter got divorced, she has 3 children, she's unemployed. I wanted to leave more money to her, but my lawyer told me I couldn't. He said it would cause problems, you have to divide it equally. So she did. And there is a lot of pressure. Financial planners and attorneys are telling you to treat children equally. Maybe you do. Every state in the country has laws about what happens if you die without a will. And every single one of those laws requires that the estate be divided equally among your children. So we're signaling as a society that equal treatment is important. So that might influence parents when deciding how to divide an estate. Okay. So I said that most cash transfers tend to go from parents to children. Where children do help, where transfers still go upstream, is in providing care to parents. So this is a graph of healthcare costs. And we know that healthcare costs increase tremendously towards the end of life. And this top line is total healthcare costs. The bottom axis is by age. It starts at 65, if you can't see, and goes up to age 100. So healthcare costs really increase dramatically. But if you look at these components, this bottom one is home health care. The one with the little squares is inpatient hospitalization. The one that goes up and where all the increase is coming from is from nursing homes. Okay, this is what's expensive. Nursing homes now average $90,000 a year or so. If you need round-the-clock home care, that's also expensive. And those risks don't really happen till you get up to age 80 or so. So they're very, very much towards the end of life, but they are very expensive. And this huge increase in cost is despite the fact this just shows you where they are. This huge increase is despite the fact that very little long-term care is provided by the formal market. So just 8% of people rely exclusively on formal home health or formal care, and most of it is either informal or a little bit of both. So families are providing an awful lot of this long-term care. This is what's really sort of providing the services for the elderly. We can't afford to give formal care to everybody. We don't have the amount of workforce for that. We don't have the financial ability to pay for it. It comes down to informal care by family members. And if you try to value out and you price out what it is by multiplying the hours that children or spouses provide by an hourly wage rate, this is what home health care costs in the formal sector, nursing home, and this is the informal care by children or other members and family members, and that just sort of swamps any kind of paid health care. And if you look to who's providing it, this is if you're married, it's most likely a spouse. If you're not married, it's your children, either co-resident or non-co-resident, and then some paid health care. But it really is an awful lot on these children. 50% of the care is provided by children. And then you can't see if it's cut off. This is the other non-paid care. So those would be neighbors, friends, so forth. So in terms of these caregivers, what we really worry about as a society, first are things related to labor force participation. Women may have to, it's mostly care by women on this for the most part. Women may have to leave the labor force to provide care to an elderly parent or to a spouse. If they leave the labor force, they may lose things like pensions, health insurance, as well as salary. And if you don't save enough for retirement, you don't have a big enough pension, that can help drive those very high rates we see about widows, the high poverty rates, so forth. The other thing that I found that's happened in some work is not so much that these women actually leave the labor force, but they have to cut back enough on what they're investing in work that they have much lower wage growth. They're not taking on the extra project, they're not staying late, they're taking days off. So even though they were keeping their job, their wages aren't growing. So that's sort of an important labor market outcome. And again, because we have these extraordinarily high poverty rates among elderly women towards the end of life, this could be an important component in driving some of that. The other thing we worry about is the health of these caregivers. There's increases in stress, increases in the incidence of high blood pressure and depression. There's worse self-reported health. But the interesting thing is there's very little change in diagnosed conditions. They don't see anything that a doctor diagnoses except high blood pressure. So it's all this stress. And one of the interesting things, there was a sociologist, Doug Wolf, who did a study. And what he found is what's stressful to be a caregiver, but it's actually more stressful to be the child of someone who needs care and not providing it. So if your sibling's doing care and you're doing nothing, that ends up being very stressful as well, if not more so, because you're sort of helpless. And as we know from a lot of literature, being helpless provides a lot of stress. I'll skip this because Joe talked about it. So I just want to take the last few minutes to sort of talk about where we go from here, or what the future might hold in terms of the economics of the aging and caregiving for the elderly. As I said, children are sort of the most important providers of home health care. We can't provide formal health care for everyone. It's too expensive. Families are doing this. But we're having enormous declines in fertility. We have an increase in the number of people who don't have children at all. So who's going to provide the care in the future? Right? We also have changes in labor force participation among women. Used to be that your daughter didn't have a job outside the home. She raised her children. When they were gone, she was available to care for mom. Now women have careers. They're going to be less likely to do that. One of the potential issues is these changes in disease-specific mortality rates. We've done extraordinarily well in reducing mortality from heart disease. We're starting to make real improvements in cancer. When we get rid of or lower the risk of dying from some of these causes, people live longer. They increase the probability of getting some sort of dementia or cognitive impairment. That's where the really expensive long-term care comes in. Someone with Alzheimer's needs round-the-clock care. You can't leave them alone, and that is extraordinarily expensive. Nursing homes that average $90,000 cost much more if the patient has some sort of dementia. In terms of things we've been talking about today, this rise in divorce and blended families. If parents divorce and children don't grow up with their father, they may be less likely to provide care for him in older ages. Stepchildren may be less likely to provide care for an elderly parent. It's sort of an interesting puzzle with blended families, step families. You have sort of more children. You have children and stepchildren now, but you may have weaker ties. And we don't know how that's going to play out in terms of caregiving in the future. Certainly it'll depend on things like at what age your stepmother married into the family or something like that. There are also important policy changes going on. There's going to be some sort of Social Security reform. And we're going to have changes in Social Security. I showed you early on when Social Security increased, we had this decline in women living with children. We had this rise in transfers and so forth. If we cut back on Social Security, what's going to happen? Are children going to have to take in their elderly parents? Who's going to really feel the effect? Similarly, there's going to be changes in Medicare and Medicaid. Right now, Medicaid pays for nursing homes primarily. That's a means-tested health insurance program. So that'll be difficult. In terms of paying for long-term care, the Affordable Care Act originally had something called the Class Act, which was going to allow people to buy an actuarially fair home health care policy. The way that was written, it wasn't able to be implemented, so it never was. And the final thing that's going on in terms of policy changes is we've moved from an era of defined benefit pension plans. Those are what you think of as old-fashioned union pension plans like the auto workers and the steel workers, where you worked for a certain number of years. Your pension was based on how many years you worked for the firm, your highest average salary, and so forth, and you got a guaranteed amount every month. Now people have 401ks, IRAs, 403bs, those plans where you sort of save for yourself, and you get to control where the investments are, where the assets are invested. If you do really well, you can reach retirement with a whole lot of money. If you do poorly, you may reach retirement with very little. Even if you do well, all of a sudden you're 65, say you have $1 million in this defined contribution pension plan, you have to decide how much to take out each year for the rest of your life. That's up to you. I'm an economist. I study this. I have no idea how you would spend down that money, how you would change your investment strategy as you get older. But that's we're going to bear the sort of risk. And you could do really well or not. If you do very well and you die with still a whole pot of money left, your children will get a bequest. If you run out of money, your children may have to support you. So the family's going to sort of end up bearing the risk on this move in pension plans. And it could, for some families, they'll work out well, and for some it won't. The other interesting thing that goes on there is talking about the potential rise in cognitive impairment because people are living to older and older ages. If you're managing this money, what do? Right now, you can sit at a computer and a few keystrokes, change all your investments, get rid of everything. What's going to happen when that's your entire sort of nest egg going forward? So those are some of the issues that I think we need to worry about going forward. And since we were talking a lot about marriage, I just wanted to put up a slide talking about marriage among the elderly. One of the issues related to Social Security is there's a spousal benefit. If you're married to someone for at least 10 years, you can get 50% of their Social Security benefit when they retire. When they die, you get their full benefit, as long as you're married for 10 years. However, if you remarry before age 60, you lose that benefit. Okay, you lose a former spouse's benefit. So if you look at let me go through this, and if you look at remarriage rates, this is 60th birthday. As soon as people turn 60, there's this huge spike in marriage. So something like Social Security is even affecting marriage rates among the elderly. So I just wanted to tie in with the previous paper, and I'll end there. Thank you.